Hello, my name is Ahmed, and I am from Somalia. Today we will discuss about retinitis pigmentosa, RP. RP refers to a group of inherited, passed down from parents diseases causing retinal degeneration and blindness. RP makes cells in the retina break down slowly over time, causing vision loss. This is a primary pigmentary retinal dystrophy, and predominantly affects the rods, more than the cones. The next point is the inheritance of the disease. The most common mode of RP is autosomal recessive, followed by autosomal dominant, and X-linked recessive is the least common in terms of occurrence. RP is a genetic disease that people are born with. Symptoms usually start in childhood, and most people eventually lose most of their sight. The most common early symptom of RP is loss of night vision, usually starting in childhood. Parents may notice that children with RP have trouble moving around in the dark or adjusting to dim light. RP also causes loss of sight, we also say peripheral vision, so they have trouble seeing things out of the corners of their eyes. Over time, the field of vision narrows until they only have some central vision, also called tunnel vision. Other symptoms that the patient of RP can have are sensitivity to bright light, loss of color vision. Let's discuss its causes. So, most of the time, RP is caused by changes in genes that control cells in the retina. These change genes are passed down from parents to children. Sometimes RP happens as part of other genetic conditions, like Usher syndrome. Usher syndrome causes both vision and hearing loss. RP can also be caused by some medicines, infections, or by eye injury, but these causes aren't as common. The incidence of the incidence disease. This disease occurs 5 persons per 1,000 of the world population. Mostly it appears in the childhood, and progresses slowly, often results blindness in advanced middle age. It does not depend on race, and males are more commonly affected than females, in a ratio of 3 to 2. When we look the literality, both eyes are equally affected. Let's discuss the clinical features of the disorder. First, let's look visual symptoms that the patient will experience. Firstly, the patient experiences night blindness, and it is the characteristic feature of the disease. This may present several years before the visible changes in the retina appear, and it occurs due to degeneration of the rods. Secondly, dark adaptation. Light threshold of the peripheral retina is increased, though the process of dark adaptation itself is not affected until very late. And lastly, tubular vision occurs in advanced cases, as the vision is peripherally constricted. Let's go deep on fundus changes, retinal pigmentary changes. These are typically paravascular and resemble bone corpuscles in shape. These changes are found in the equatorial region only and later spread both anteriorly and posteriorly. Just have a look on how this disease affects the fundus. These are 3 main substages of RP, starting from periphery to center of fundus. Retinal arterioles are attenuated means, narrowed and may become thread-like in late stages. Optic disc becomes pale and waxy in later stages, and ultimately consecutive optic atrophy occurs. Other associated changes which may be seen are colloid bodies, choroidal sclerosis, cystoid macular edema, and atrophic or cellophane maculopathy. Let's discuss now the visual field. Changes occur in RP. Annular or ring-shaped scotoma is a typical feature, which corresponds to the degenerated equatorial zone of the retina. As the disease progresses, scotoma increases anteriorly and posteriorly, and ultimately, only central vision is left, which means tubular vision, or tunnel vision. Eventually even this is also lost in late stages, and the patient becomes blind. Next point is the electrophysiological changes of the disorder. Typical electrophysiological changes appear early in the disease, before the subjective symptoms or the objective signs, or fundus changes appear. Electroretinogram, ERG, is subnormal or abolished, and electrooculogram, EOG, shows absence of light peak. The clinical triad of the disease. There are 3 important points to remember when you are dealing with patient of RP, and these are arteriolar attenuation, retinal bone spicule pigmentation, waxy disc pallor. Lastly, the treatment of the disease. It is most unsatisfactory. Rather, we can say that, till date, there is no effective treatment for the disease. We can take measures to stop progression, which have been tried from time to time, without any breakthrough, include vasodilators, placental extracts, transplantation of rectus muscles into suprachoroidal space, light exclusion therapy, ultrasonic therapy, and acupuncture therapy. Recently, vitamin A and E have been recommended to check its progression. Second is low vision aids, in the form of magnifying glasses and night vision device, may be of some help. Rehabilitation of the patient should be carried out, as per his socioeconomic background. Prophylaxis plays a key role in the management of RP. Genetic counseling for no consanguineous marriages may help to reduce the incidence of disease. Further, affected individuals should be advised not to produce children. That is it for today. Thank you.